Hello students, welcome to the class. Our subject is Nursing Foundation and we are discussing about nursing standards. Now, as you all know, nursing standard is a set of descriptive statement which help to evaluate the nursing care, which help you to perform in a right way so that you can give the right qualitative nursing care to a patient. It's a guidelines. So, nursing standard is a guidelines. Now, what's the purpose of nursing standards? Now, nursing standards it provide a direction for the nurse in which way, what type she need to behave, and she need to provide a qualitative nursing care to a patient. It provide a baseline information so that a nurse will have a knowledge about the procedures, process, and legal aspects regarding all the unethical and ethical ways, malpractices, everything. She should have an idea. So, nursing standard which help the nurse to develop a sound knowledge. Nursing standards which help to improve the quality of nursing care. See what care you are giving, that will be qualitative. Now that will be qualitative only because we are following or practicing the nursing standards. It help to improve your performance. It help to decrease the malpractices, nursing negligence or tort. It helps to bring the good coordination between nurse and patient. When you do something for the patient, that will be in a better way and patient will accept you in a right way. Then nursing standards which help to determine a set of behavior. It guide the nurse how and in which way she need to behave when she work under any organization, any institution or any hospital. Now, nurse standard it helps the nurse to be more accountable. That means she will be take a responsibility of her behavior. She develop that quality of autonomy. She take a responsibility of what she did and whatever she do that she'll be doing with full of responsibilities. So this is the purpose of nursing standards. Now what are the method and approaches of these nursing standards? Now that can be easily described when you elaborate, when you spell it, that standard like standard. Now each word will give a meaning so that you will have a better understanding. It is very simple. Now S stands for successful termination of helping relationship for client. So it says that it says that because of standards we are able to have a good relationship with the patient. Now T to have a clear idea and conception about the distinct goal. Now T means with the help of nursing standards, nurse is able to develop the right idea. It will help the nurse to set the right goal, because as you all know that nursing standard is a guideline, so definitely it will help her to get a right idea and some concept about the process. A for assertive planning. So she will make a assertive planning. She will take the responsibility of her action. Then N, nature of client and nurse interaction. So when we follow the standard practices, definitely will improve the nurse patient relationship. We develop a therapeutic communication and therapeutic nurse patient relationship. D for directing others. So here when we work in a group, definitely we are able to give a direction to others what work is supposed to be done by others. A for analytical thinking. It's a brainstorming. You're thinking in a way that so that we are able to sort out the problems. R, respect status and policies. Here you are respecting the policies. It may be hospital policy, personal policy, implied or expressed policies. You are able to respect all the policies which is implemented. D for data collection in a right way. You are collecting a detailed data of your patient or any relative matter which you want, that will help you to reach your goal. So standard. Standard. S for successful termination of helping relationship for client. T to have a clear idea. A for assertive planning. N for nature of client and nurse relationship and communication. D for directing others. A for analytical thinking, R for respect the status and the policies, and D for direct data collection process in a definite way. Okay. Next, we'll move to the process, like steps in nursing standards. How do we make a nursing standards? How we can develop that? Now here for that, so now we are discussing what are the steps are involved in framing a nursing standard. Okay, mainly we can see our first 5 steps. First, you select the group members. You select the people who can be in this group. Okay, now here you select those persons who from the same field, same background, same nurses, or who meet periodically, so that they should able to talk, communicate and discuss and frame the ideas, all those things. So first is selecting the group members. Second, you divide the area in each area you want to work and set the standards. So that must be divided, because when you say it's a nursing department, we can see nursing entire department is a vast department. It's very broad, a different stream you can see. So you need to select now which area we want to work and set the standard. Third is review. Now here we are going to review a hospital, institutions, policy, objects, a philosophy, everything related to that we are going to review. We are going to recheck. We are going to reassess. Okay. Then fourth step is reviewing of theories of nursing practices. What nursing procedure you are doing, what nursing care is given to the patient, client satisfaction, client role, what service is received by the client. Related to the nursing process, we are making a review. We are rechecking. We are assessing in detail. So only related to the nursing process. And fifth step is, after doing all these, you are writing, you're formulating a nursing standards for that particular department or particular area. So these are the important 5 steps involved in formulating the nursing standards. Form a group, divide the area and you decide where you want to make a standard. Review about the hospital policies, philosophy, objects, purpose, everything. Review the theories or nursing process, and finally formulate the standard. Fine. After formulating, we need to know what are the different classification of nursing standards. Now here we can study about 3 nursing standards: structure standard, process standard, outcome standard. Now structure standard, it is mainly a deal about the physical facilities, physical environment what we are providing, like physical equipment, staff members, information about the organization, how big, how many bedded, who all are there, how many are working. All these physical informations are gathered. Here a set of standards are framed when it's totally related to your physical facilities. So it's a actual standard of setup which involved about the institution physical setup we are talking. We are discussing, we are making a standards which is related how it should be your physical environment related to that. Okay. Also it focus about the philosophy, object, purpose. Your philosophy says that we should give a right quality of care. That means there should be a right number of staff, right number of hospital beds, right number of manpower, everything. So it has to discuss about all these matters. Next is process standard. Now this process standard is discuss about the nursing service, nursing care what you are giving to your patient, like your assessment, nurses assessment, maintenance of nurses record, documentation and nurses reviews. You're asking some questions with the nurses regarding your process, your work what you're doing or care what you're rendered. Now here it is completely described about the nurse behavior, when she and how she will, where she will and why she will, what type of care she will give to a patient. These are all things related to nursing process we are making. We are trying to set the nursing standard. Third one is outcome standard. Now outcome standard is related to a result of your patient outcome after doing all the intervention. What is the expected result? So regarding that you are writing your standards. So it's a descriptive statement where desired patient care results are the outcome standards. So this is the important three type of standards: structure standard, process standard, outcome standard. So I hope you understood. We discussed about the nursing standard purposes, and we discussed how to frame these nursing standards, steps involved in formulating these nursing standards, and types of nursing standards. Also, please go through that method, abbreviations of standard, STANDARD. So that will give a very simple and easy idea. I hope you understood. I'll see you in the next class. Thank you.